Hello everyone. While ago, I was talking to someone over Facebook. I don't exactly remember what it was about, but he asked how we worked. He asked about our priorities when we are operating the patients, like what are the things that you consider, something like that. I don't recall the exact words, but I told him that I would make a video about this subject. I wrote him. Here's what I would like to talk about: our working algorithm. How do we choose our patients? How do we accept them for surgery? Who do we accept and who we don't? What are priorities about that? Again, since I have taken some notes, I'll check my notebook once again. There are so many things to talk about. After you shoot the video, you cannot add these things in between the lines, so I'm taking notes beforehand not to leave anything out. Now, it is like this. For once, we evaluate the patient before the surgery. You can call this an examination, but evaluation is actually something beyond examination. It's not just that. You evaluate from a couple of different angles. I have these under three main headlines. The first one is the patient fit for the surgery? I mean, not about the surgery that he or she is about to have. In a general sense, I think whether he or she is someone suitable for an operation. For example, is the patient in a state he or she can evaluate the psychological consequences of the surgery about to take place? If there's a psychological disease, then we avoid having a surgery. If there's a lack of intelligence, we again avoid the surgery. The patient must have an ability to reason regarding the surgery. Other than that, his or her expectations must be realistic. If you operate on a patient over the top of the expectations, then disappointment is guaranteed 100%. The patient is bound to be disappointed. Such patients should not be accepted for surgery also. The patients must have realistic expectations. Here are our job. As experts, doctors, is to guide the patient. If the patient has a very high expectation, it is very important to say this and that can be achieved with the surgery. These are the limits. What you have in your mind cannot be done. This must be told to the patient. Other than that, does the patient know the risks involved? Do they share the responsibilities of these risks with us? This is the thing that get me very angry. The patient asking for a guarantee. I think I must have written about this in a couple of other platforms. I wrote this on Facebook many times. Some patients have probably learned about this and they keep asking me, is there a guarantee, doctor, just to get me angry. Doctor, I want to have the surgery. Do you guarantee the results? Just tell me, what's guaranteed in life? I mean, is there any guarantee that you'll get home after you leave work in this evening? Does someone guarantee you this? A political party makes so many promises, but do they guarantee anything? Do they make guarantee saying when we come to power, dollar will be this much, will decrease inflation, eliminate unemployment and such? Do they sign a written document and hand it to you? In life, you only have a guarantee when it comes to household appliances, and that is only for 2 or 3 years. Come on, you are talking about surgery, about medicine. There's no thing such as guarantee. A patient asking for a guarantee means I'm actually not taking any responsibility about this. You are completely accountable, doctor. And it is important not to operate on a patient who does not accept any kind of accountability. So if there are some young surgeon colleagues of mine watching this video at this moment, keep in mind that this is an important thing, my friends. If the patient is looking for a guarantee, it means I'm not taking responsibility for this. The whole responsibility is on the shoulders of the doctor. And if there's even the tiniest problem, I'll give you help. Do not operate on a patient who doesn't take any responsibility. The man undergoing surgery, but he doesn't accept any responsibility for it. Then why are you operating him? He should go and operate on himself. There are no guarantees. The patients must share the responsibility with the doctor. What is the doctor's responsibility? If there is any kind of complication, he or she needs to be able to handle it. We are trained for this. We specialize 6 years for that. Here, what do we learn here? We learn how to operate. Plus, we learn how to deal with a problem in the event something happens. I'm humbling out of anger. Now, look, I said complication, by the way. In a world where there are complications, in this reality, you cannot have any guarantees. There is something called complication. What is a complication then? It is unwanted outcome. The stitches are opened up, infections happen, bleeding occurs, you can have an emergency surgery in the evening, and the patient bleeds in the morning. These things may happen. These are complications. How can you make any guarantees that these will not take place? And please, patients shouldn't ask for any guarantee, whatever. This guarantee thing, as you can see, jump on my nerves. We have to share the responsibility. Our expertise or responsibility is to provide you with sufficient information about surgeries. We need to explain the possible complications in a completely transparent way. If they do take place, we need to share the responsibility, perform the surgery, and if any complication occur, we need to handle it. This is our responsibility. Let's not put all the responsibility on the shoulders of the doctor, please. Then, the thing we consider in the second phase is the patient fit for this surgery? Now we understood that the patient is someone suitable for the surgery. Now we consider whether he or she is suitable for this kind of operation that he or she wants to have. Now, let's say it's a butt transplant. The patient who comes in for a butt transplant is, let's say, is an overweight lady. Her hips are this wide. Brother, this person is not suitable for this operation. Don't do it. The patient comes to the doctor with a hip like that. It's all overweight with cellulites and asking for a butt transplant. Do you think that after a butt transplant you'll be like a Playboy cover girl? If this is your dream, then this is not a realistic one. These prosthetics will not change anything on that patient. This prosthesis will be buried inside that hip and disappear. Prosthesis will not even show itself. I'm giving this example because it's very obvious. A patient for butt transplant must be, in my opinion, a thin patient. She should not have any cellulites on her hips, and her butt must be flat. Then when you place a prosthesis on such a patient, it makes sense since she will turn into a Barbie doll. It really becomes beautiful. If you'll do it on a patient like that. So if the patient is suitable for the operation or not. This is critical. So at the end of the surgery, well performed, are we going to have a good result or not? How much is the patient going to be satisfied? 100%? 50%? You need to consider this. If the patient is suitable for this operation, then we accept them. We say, okay, let's do it. Honestly, when there's an unfit patient, I directly refuse them. I say you are not fit for this surgery. But this is something not said much. Why? Not I worked in private hospitals before, I also worked in private polyclinics before I had my own office. Whenever I refused a patient and sent them away saying you are not fit, the management got upset. Why are you sending the patient away? Hospitals demand that every patient should turn into a surgery because they will earn money. But if the patient is not suitable, I send him or her away. I say, not for you. You will not be able to get a good result from this surgery. And this is something the hospital management doesn't like. They say 5 patients came and this guy sent 2 of them away. They don't like such doctors. Finally, now I work privately for myself at my own office. And I can make my own decisions as I want. If a patient is not fit for the surgery, I say you are not suitable and send the patient away. Is that clear? I believe this is the right thing to do. This is how I work. Third important point is that am I qualified enough for this operation? This is the question. Can I perform this surgery to these patients in a good way? I consider that. We have less experience in some surgeries compared to the others. In some operations, I am very experienced. In some surgeries, I say to myself, there's no one more experienced than I am. Of course I'll do it. But in some surgeries, I say, I don't have much experience about this. Meaning, I can mess up. To be clear, this is what I say to the patient. There are such and such people you can go and you can choose one of them. These are the most experienced people about this surgery. I give the patient some names. So I direct the patients to my colleagues who are specialized in that area where I have limited experience. I direct them to the ones with the most experience who have a special interest in the field. Look, I can very well perform the surgery on that patient. I can also take his or her money, but patient satisfaction may not be 100%. Instead of struggling with the surgery that I don't have much experience in and getting it done somehow to have a result, I prefer to accept patients regarding the subjects that I'm most experienced about. When it comes to the surgeries that I have little experience, I say that there are such and such people specializing about this operation in the plastic surgery community. I tell that to go visit one of them. I'll say it will be better for you like that. And I send the patients away. Our operations are like this. Is the patient fit for the surgery? Is the patient appropriate case for the surgery that he or she wants? And thirdly, would I get a good result in the surgery? If we can say yes to all these questions, then we can perform the surgery. Naturally, the patient is satisfied as well since I'm doing the thing that I'm experienced in. I think this is the best way to work. I don't remember with whom I texted on Facebook, but I really thank to that person. Our conversation began about an interesting subject. Actually, it would be a good thing to make a video about that as well. Thank you for watching. I'd like you to visit my other videos as well. Thank you very much.